Good evening, Dr. Roberts. Thank you so much. It is such a pleasure to be here with you this evening. This is my first visit to Lufkin, and I am thrilled that it's as part of this event. You guys know this, but what an incredible evening this is. Not very many communities do this, and I travel all over the country to devote an entire evening to celebrate the dedication of people that have decided to spend their lives, their careers helping us when we're at our most vulnerable, when we're sick, when we're injured, when we're hurting. It's an amazing thing, and I very much am humbled to be here to talk to you a little bit tonight about the work that I do with folks like you and healthcare providers across the country related to communication. So tonight's a celebration. We're celebrating. There are awards that are turned so you can't see them tonight. We're going to celebrate the dedication of 4 individuals, but we're really celebrating the dedication of all of you who are involved in healthcare. But healthcare is, as Dr. Roberts pointed out, I think probably one of the most personal experiences that any of us have in life. And so the celebration really is about each one of our celebrations and what healthcare has meant to us. So to start and set the tone, we're going to have a really simple audience participation exercise. I promise it's not painful. So I want you to think about, and if you want, maybe you want to close your eyes. And I want you to think about, you don't have to. I want you to think about a time in the past, a moment, an experience with healthcare that changed your life in a significant way. So if you're a healthcare provider, professional, if you're a doctor, if you're a nurse, if you're a therapist, if you're a clinician, I want you to think back to a time when you know that because you were involved, you made a significant difference in someone's life, and that made a significant difference in your life. If you're not a healthcare professional, we've all been patients or we've all been family members of patients. I want you to think back to a time when, because there was a dedicated, talented, caring healthcare professional involved, it made a huge difference in your life or in a loved one's life. So bask in that memory a little bit. How did you feel then? And remembering that time, how does that make you feel now? That's why we're here tonight. Whatever that memory was that you brought up, that's what we're celebrating here tonight. And I'm a storyteller, so you're going to hear lots of stories tonight. I wish I had the opportunity to go out to each one of you and hear that story, and hear why that was such a significant time, a significant point, and a significant experience in your life. Obviously, we don't have time to do that. But I will ask you a question about what came to mind. Did that time and that event or that experience come to mind primarily because of the superb technical or clinical skills that were brought to bear, either by you as the healthcare professional or to the patient or family you were serving? Or did the event come to mind because of the human-to-human connection that was made at that point and the difference that that connection made in your life and somebody else's life? How many of you thought about the latter? How many of you thought about that human connection? I don't want to minimize the importance, obviously, of the clinical expertise and knowledge and skill that all of the healthcare professionals in this room bring to their practice every day. Obviously, that is absolutely critical. But for those of us who come to you as patients or family members that come to you as patients, you know, we kind of expect that. We wouldn't come to your office, we wouldn't come to your hospital, we wouldn't come to your clinic if we didn't think you were really skilled at what you did and you would provide great quality care to us in a very safe way. It's that connection that you provide at a really vulnerable time that I think often makes the difference. And as Dr. Roberts pointed out, that connection is at a little bit of risk right now. I'm a little worried too. Technology is a wonderful thing, but I was in a meeting recently with a group of physicians talking about the issue of connections with patients and how important those are for many, many reasons. And one of the physicians pointed out, it gets harder all the time because of that electronic record. And I don't think anyone would argue that there are obvious benefits to the electronic record in terms of how we collect data for individual patients and how we collect data across patients that's going to help us better understand the best treatment protocols and the best way to approach particular diseases. But you also can't tell me, even though the computer companies tried for a while, that EHR is saving you any time. It's pulling you away. It's pulling you away. So given that, we're not going to walk away from the EHR. But we better be really, really good at the connection and the communication. We've got to be better today, I think, than we've ever been because we have less time. And so the healthcare providers I work with across the country, that's a lot of what we focus on. We don't have a lot of time, so let's make the time that we have the most valuable. The most valuable for us and the most valuable for the patients and families that we take care of. And so those are the stories I want to tell you about. I got the best job in the world. I get to go around the country and meet and work with incredible people like you who I learned so much from, insights I gain, and I get to share that with you and with other people I work with. And so I have several stories I want to share with you that I've learned over my career from very smart people like you. But the first one is a very personal story. When I was a patient a few years ago, no offense to the healthcare professionals in the room, but I try to avoid being a patient as much as I can. But when I need you, I need you. So this is a few years ago, and and you may hear it in my voice, one of the occupational hazards that I have in my work is I spend an awfully lot of time on airplanes. Last year, I was on 259 individual flights during the year. Now you're saying, are you crazy? How do you know you were on 259 individual flights? If I'm going to be on that many airplane flights, I'm going to keep track and I'm going to get the status that I deserve for giving as much money as I do to Delta Airlines and Southwest and a whole lot of other people. So as you probably know, the airline air and the surfaces are not exactly the most healthy environment. So I sort of live with this constant, perpetual sort of cold, and it usually is not bad, but sometimes it sort of acts up. And at this point, a few years ago, it was acting up. And I was not feeling really great. It was Memorial Day weekend, and it was Monday, and I had a really crazy week coming up. And I thought, the cold's getting worse. I'm having pain here. I'm thinking maybe sinus infection. The head cold is kind of becoming in some ways a chest cold, and so maybe I should go see someone. And there was an urgent care center that opened near us by a physician that had a great reputation, and so I thought, I think I better go have the physician take a look at this and see if I might need an antibiotic. So I stopped by. I got in very quickly. It was very efficient. People were very, very friendly. I got to the doctor and I started describing my symptoms in terms of the pain in the face, but also, and I think it's kind of, I'm feeling congestion and sort of a tightness too in my chest. And she said, talk to me a little bit more about that. And I said, and I was struggling to describe and everything, I said, well, it's almost like, somebody sitting on my chest. And I could tell by her facial expression that I had said the wrong thing. If I could just take those words and pull them back and rewind real quickly, because she said, I'm afraid what we need to do is you need to be someplace other than an urgent care center. So I need to send you to the hospital, and I need to send you in an ambulance. I see my life flashing before my eyes. I'm thinking, what have I done? And I was talking fast, but I was not able to talk out of going to the hospital. But I did at least get to the point where it convinced her that my wife could come and pick me up, and I would not have to go to the hospital in an ambulance. She said, "We're going to call that hospital, and you better show up, and we're going to make sure that you are." Now, the call to my wife was another interesting chapter in this little story. You're where? And you need to go to the hospital? I thought you were going to Home Depot to buy light bulbs. I did go to Home Depot and buy light bulbs. I got that done, but I made this little side trip. So my wife says, "Okay, I'm on my way." You do remember this is Memorial Day weekend, and my son was home from college, and my daughter had agreed. We were having a nice dinner that night. We were having my wife had planned, and she said, "We're still having a wonderful dinner. I'm going to take you to the hospital and let them prove that you're not in the middle of heart failure." So she drops me off, and I go in, and it actually was very efficient. It wasn't as busy as I expected. The triage nurse was ready. She was the ideal triage nurse. She was running the trains on time. And things were moving through the way they were supposed to be moving through. She was very, very efficient, but she was also very direct. So I sort of misunderstood, or I interpreted her instructions wrong, or they were somebody else, and I started wandering off because I thought I needed to go there for the EKG, and she said, No, you, chest pain. You're supposed to be over here. You need to go this direction. So I wandered over there. I was chest pain now. Got the EKG, and pretty soon they figured out, okay, I think this guy is not in the middle of heart failure. But we need to make sure you need to have a stress test before you leave, so we need to keep you overnight. I was having my own little personal stress test at that point, and I was failing miserably because I'm thinking, so tomorrow, Tuesday afternoon, I'm supposed to be traveling with a colleague from my largest and most important client to a meeting that starts on Wednesday, a workshop in front of 200 people at one of their largest hospitals. Now, I do think I'm having a heart attack. But they said, no, we think you're fine, but you need to stay overnight. And so there's not a bed for you right now. So go back to the waiting room. And my wife had brought me things to work on. So I had my computer, and I was in good shape. And I was getting work done. I found a little quiet corner, and an hour goes by. And 2 hours goes by, and I get up and start wandering around in front of the security guard and the triage desk just to make sure they hadn't forgotten about me. They hadn't. And someone said, "We've got a bed ready for you. We'll take you upstairs." Now you can imagine by that time it's pretty late. I'm disgusted with myself. I'm tired. I'm kind of embarrassed. And I'm really worried about this huge workshop on Wednesday. But I arrive up on the floor, and there is a ray of sunshine waiting for me. "Mr. Stamp, how are you? My name is Misha, and I'll be your PCT tonight. And I'm going to try to, you look really tired. And we're going to try to get you settled. I'll do what I need to do, and we're going to try to get you settled so that you can get some rest tonight." I knew I was not falling asleep tonight, but I loved that sentiment. And so she said, "So let's get done what we need to get done. We need to hook that EKG machine back up. So take your shirt off, and I'll get the EKG back on, and then we'll get you in bed, and you can get some rest." So I take my shirt off, and Misha is beginning to put the leads on, and she's talking with me and says, "So, looks like you've been working out? Looks like you're trying to stay in shape?" It will not surprise you to know that there is no Brad Pitt hiding under this blue shirt. I am a modest boy from the Midwest, and on the very, very rare occasions that I take my shirt off at the pool or beach in public in front of anybody but my wife, "Wow, it looks like you've been working out," is not something I generally hear. Now, why do I tell this sort of embarrassing story? I tell it for the takeaway from that story and what Misha really did that evening. And she wouldn't describe it this way. But what she did when I walked into that floor and she greeted me, she thought of me as a person first and a patient second. The reality is, we all want great health care, but none of us really want to be a patient. But sometimes we need to be a patient. We have to be a patient. What a wonderful thing when we do need to be a patient, that people understand that we're a person, a human being first. It was this incredible gift because everybody else I'd seen that night, they were kind, they were professional, they were competent, they did a good job, and they thought of me as chest pain. The nurse even called me that. You, chest pain, get over here. Misha saw a poor, tired, frustrated soul, and she was going to try to make the rest of my evening as good as it possibly could be. The other takeaway from that evening didn't have anything to do with anything else that Misha did, but it had to do with how I thought about that experience. So I get settled, they put on that awful gown we wear, and I'm in the bed, and I'm exhausted, but I'm wide awake. And you know, when you give former hospital administrators time to think, it's not always a bad thing, but when you give them time to overthink, it usually is a bad thing. And I was overthinking. So I'm laying there and I'm thinking, you know what, maybe she shouldn't have said that. You know, maybe that wasn't an appropriate thing to say. I mean, maybe that was kind of, you know, maybe people could be embarrassed by that, or maybe, and I stopped. I said, wait a minute. She just reached out to you, human being to human being, and thought from here instead of here, and made an incredible difference in your evening. And I started thinking about, maybe it's not appropriate because we wouldn't script that. We wouldn't tell people to say that. If we script too much, if we overthink what we tell people to say to make the experience a good one, I think it comes from here and not very much from here. I think it's a huge opportunity for us to not lose what comes from the heart. We have to be smart too, obviously. But what comes from the heart is probably a lot of what you thought about when I asked you to remember back to an experience with a healthcare provider that was really meaningful for you. So how do we do that? How do we not lose that? How do we nurture that? So I've got a handful of things to share with you, stories and examples from smart people I've worked with and great organizations that I've worked with. And to help you remember these, in case you want to remember them, beyond dessert, you may not, there's a little mnemonic. So the word talk, T-A-L-K. And we think about how we talk to each other as professionals, how we talk to patients, how we talk to their family members. And the first letter, T, in that little mnemonic stands for team. The reason it stands for team, this is very, very research-based. I do a lot of work with Press Ganey. So those of you in the room who are healthcare professionals probably recognize that name. If you're not, Press Ganey is the largest research firm in healthcare related to patient experience research. Press Ganey's been around for 30 years. It was founded by Drs. Press and Ganey in South Bend, Indiana. They were professors at Notre Dame. And it's really Press Ganey has set the standard for how we think about surveying patients. So if you've been in the hospital or if you've been in an emergency room and you get a survey, high probability it came from Press Ganey. There are other companies that do this too and do it in a very good way. And so they track all the questions that they ask and how much those individual questions are related or correlated to a patient's overall satisfaction. In other words, where do we need to focus? What are the things that really matter most? We talk a lot about food in hospitals not being great. It doesn't matter. Food ranks way, 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 way down here. Because if you serve lobster and the care that you got from the nurse and from the physician wasn't great, it doesn't matter. But what does matter, and one of the questions that has always been at or very, very close to the very top of the list, is how well staff work together as a team. And when we talk to patients about that question, what do you think about? How do you consider that? How do you answer that question? What does it mean to you for the staff to work well together as a team? The phrase I hear most often is, they were all on the same page. They all talked to each other. My doctor knew what my nurse, knew what my therapist, knew what my case manager knew. The nurse on the day shift told me the same things that the nurse on the night shift told me. One of the things that's most disconcerting for patients is when they hear different things from different providers because they're not sure exactly what to believe. Well, so the doctor told me I'd be discharged tomorrow, but the nurse says I probably won't be discharged for 3 or 4 days. What does that mean? Maybe the nurse sees something, what's happening? And so that communication across the team is absolutely critical. So when I work with hospitals and they begin talking about, we want to improve our overall patient experience, so we're going to work on communication with the patient, I often say, why don't we work on communication across the team first? Especially if I've seen their scores on how well staff work together as a team. So that's the first reason that T stands for team. There's another really, really important reason. This is very, very rewarding work, but this is very stressful work, isn't it? It's emotionally stressful. It's often physically stressful. We're stretched in a lot of different ways. And if we want to be at our best when we take care of our patients, we got to hang together. We've got to support one another. We've got to be able to lean on each other if we want our patients and our families to be able to lean on us in a really important way. So T is team. A, anybody want to guess? A is ask. Questions are really, really important in healthcare. And they're questions in both directions. They're the questions that we ask patients and families and one another, and they're the questions that we encourage them to ask us. I've so often talked to physicians and nurses about this issue, and I said, have you ever had a patient that said they didn't have any questions, but you knew they did, and said, yeah, like 5 minutes ago? It happens all the time. Patients, we're intimidating places. Hospitals aren't places that people are terribly comfortable being in. They don't want to look stupid. And you know what I hear more often than you might expect when I talk to patients? I know how busy they are. I didn't want to bother them. Not everyone, but a lot of patients. But when they don't bother us, we don't have that connection and we don't have the understanding of where their level of understanding is. And we've left off the table maybe some really, really important things. I had the good fortune to work with, over the past year, a major acute rehabilitation hospital group. And so I spent lots and lots of time learning about acute rehabilitation and the wonderful things that providers do in acute rehabilitation. And I was talking to patients, and I remember well this one very nice woman, I talked to her in the gym, and how has your stay been? It's been terrific. The people are so caring, they're so wonderful. So are you ready to go home? And there was this silence, and I said, so there must be something that's causing you to not feel completely comfortable going home. And she said, my shag carpet. You know, that walker that I use here is on those tile floors, but I've got shag carpet in my house, and I'm really concerned that that's not going to work, and I'm going to fall again, and I'm going to be in really big trouble. Seems like a small thing, but it was a really major thing to her, and somehow we missed that. Somehow we didn't get that, that question answered. So when we talk to healthcare professionals, we encourage, first of all, to go beyond the question we all ask. And I fall into this trap. This is the one important piece of advice I give where I have to stop and I have to think about, do not say, the question we all ask is, do you have any more questions? What's the problem with that question? It's a yes-no question. It's a closed-ended, and often we use it so often that it almost can become a rhetorical question. And what's the answer we most often get? Nope, I'm good, I'm fine, I got everything I need. So we encourage at least taking it to the next level of an invitation. What other questions do you have? What are the concerns? What are the issues? What are the things that are worrying you that we need to address that we haven't yet? And sometimes it takes even more, a little bit more encouragement than that. You know, I work with a lot of stroke patients. And they usually have questions about, do you have any questions about that? Opening that dialogue and answering those questions is a critical part of making the patient feel comfortable going home and continuing successfully on their rehab. So A is ask. L, you should be able to guess. It's listen. And I think it's the hardest part of being a great communicator. It's the thing I work on most. And my wife would tell you, yes, and he should keep working on it. How often after a busy day, if I get home, and I got the head nod going, the bobblehead is working, and I'm even like the eye contact is pretty good, and she's talking to me, and 10 minutes later I'd say, you know, why don't we go out to that restaurant for dinner? Yes, like I just told you 10 minutes ago we were going to do. Listening is tough work. And it's tough work today because we get more distractions than we ever have. Those darn notifications are going off on that cell phone, and the email inbox is piling up, and we're being pulled in so many different directions, and we have less and less time with the patients we take care of and the colleagues we have. We've got to be really good listeners. And we've got to be really present and focused in that little bit of time that we've got. This really came home to me in a powerful way and really influenced the work I do now more than 20 years ago. So this is the toughest story for me to tell you. This is the really personal story. It was 20 years ago, and my dad was in the final days of his life, and we knew that. And he had been admitted to a fine and very reputable academic medical center. And we had the bad fortune of him being, it was kind of a 3-strike. He was admitted on a weekend. That weekend was Labor Day, a holiday weekend. And remember when Labor Day is, it's at the very beginning of September. What happens in academic medical centers at the beginning of each month? That whole rotation had changed. And his primary specialist was out of town. So one of the unfortunate results or symptoms of my dad's disease was he had a partially collapsed lung. And he had had a partially collapsed lung, and it wasn't going to get better. But when the resident came in to see him with compromised breathing and with, we need to address that, so we called in the cardiovascular fellow. And the cardiovascular fellow, an incredibly bright young man, confident. I am sure in the past 20 years he has saved thousands of lives. But the thing he needed to work on then, and I hope he has since, is listening. Because he was on a path of, we need to put in a chest tube. And we said, no, we don't. This is really not what my dad would want. This is not what we want. But he didn't really want to hear that. I could forgive the fact that he didn't do a very good job of looking at the documentation that my dad's specialist, I'm sure, had in his chart. I can forgive that, but not being willing to listen to us, I struggled with a lot. And the next several days were hell. They were horrible for my dad, physically and emotionally, and they were worse for my mom. There is a hopeful ending to this story. So my dad's specialist, who he loved and my mom loved and we all did and took such incredible care of him, was not only out of town, she was out of the country. And she got back the Monday after the Labor Day, a week later. And by that time, my dad was able to get home on the following Sunday. So we had been able to get him back home. And early on Monday, the phone rang, and my mom picked it up, and she said, "Mrs. Stamp, this is Dr. Suda, and I am so sorry for what happened to your husband while he was in the hospital. How is he, and how are you?" And then she listened. So that experience, and by the way, that call, maybe it didn't make everything right, but it came close. It gave me new faith that there are people out there that do understand how important it is to listen. I thought, we've got to find ways to take what Dr. Suda understood and help that incredibly bright, promising cardiovascular fellow. So listening, if I could make one change in healthcare, I'd change how we listen and how much we're focused on that, and not worry so much about what we say, but what we hear from the patients we take care of. So the last letter, K, there are not very many pages in the dictionary with words that start with K. So anybody want to hazard a guess? K stands for karma. So in the organizations that I work with, karma is really important. It's either really good, and it really helps people be at their very best. It helps them connect to each other and connect to patients in a really meaningful way, or it doesn't. Now, you usually hear this described as culture. So why didn't you call it culture? Well, that starts with a C, and I wasn't going to be cute and have culture start with K. And I kind of like karma. Karma is incredibly important. And so, but it's one of those things I know when I see it, I appreciate it when I'm in an organization or I'm in a practice or a situation where it's really good. But how do you influence that? Well, one of the ways you influence it are all the things I just talked about. Things like person first, patient second, and good listening and great questions and team. But there's one other thing I'll add. And it's a simple ratio, 5-to-1. So I learned about this a few years ago, and the ratio is 5 positive things or appreciative statements to every 1 negative or criticism. And this is not just something that I made up or somebody made up and, gee, 5-to-1, that sounds right. This actually came out of research originally with couples. So psychologists looked at the interaction between couples, and what they found is that 5-to-1, 4-to-1, 5-to-1, in that area was kind of a sweet spot. And what they found was when the ratio dropped and there were fewer positive comments or interactions to negative, the divorce rate went like this. So a few years ago, 3 really smart people at the Harvard Business School said, this probably works for organizations too. And so they structured a study, and they took a large number of companies across industries, and they divided them into high, medium, and low performers. And the way that they looked at this, the metrics were the hard metrics. It's not the soft. It was market share and operating margin and growth and stock price performance and quality metrics, all those kinds of things. And then they sent researchers into those organizations to understand what the interaction across those organizations, colleague to colleague, manager to employee, leadership to middle management, what those looked and felt like. And what they found was in the highest performing organizations, there were 5.6 positive comments for every 1 negative. In the lowest performing organizations, they found that there were 0.38 positive comments for every 1 negative. In other words, there were about 3 times as many negative comments or criticism as every positive. Now, negative or constructive criticism is really valuable. We need that. We need it to help one another get better. We need it to hold people accountable. We need it to make sure that people understand what they're supposed to be doing and how they're supposed to be doing and how they can get better. But if you only do that, I think it creates really bad karma. I think it drags organizations down, it drags people down. And that those positive comments help lift people up. And it makes those negative or constructive criticisms even more powerful, because there is that balance. So that's one of the things that we talk about with organizations in terms of creating that. By the way, I always ask in hospitals or in practices, so where do you think your ratio is? People say, it's probably not 5 to 1. So we have an opportunity in a lot of ways, I think. I have one last story for you related to karma. And it's from my hometown in St. Louis, and it's from a hospital that I had the very, very good fortune to work with for a number of years. And they had really good karma. And they worked on it really hard. And this story is in the middle of January in St. Louis. And it is a very, very cold, windy, blustery day, and 6 inches of snow has fallen on the ground overnight. And the CEO, John, of that hospital is arriving at about 6 a.m. And he's got that briefcase that we all load down and take home but never open because it makes it feel really good to carry it home. And he looks across the parking lot and he sees a member of his staff cleaning off her car. John says, "It's really, really cold, and the wind is blowing really hard, but I should go help that staff member clean off that car." And he took his scraper and walked over. I thought that was the end of the story. So John walks over and knows the staff member. It's a nurse in the emergency room, and engages in conversation. And so how was it overnight? Was it really slow? Was it because of all the weather? Was it a busy night? And she smiled and she said, "Well, actually, I'm not coming off my shift, I'm coming into work." And he said, "What is your car doing here and why are you cleaning it off now?" And she said, "Well, actually, it's not my car. When I was walking in, I got here a few minutes early, I noticed the car was parked in a handicapped spot, and I thought, you know what? The person coming out is probably really going to struggle. And I stopped to clean off the car." That's great karma. Now, did every nurse stop and clean off a car in the parking lot when she came in? No. But that nurse did. And that culture or karma that was created encouraged that. Was she an exceptional human being? Of course she was. But she was made even more exceptional because of the culture and support that was created in that hospital. I feel really good karma in this room. I have really appreciated the opportunity to be with you tonight and to share with you some of the things that I've had the good fortune of learning along the way from great people like you. Congratulations to those who will be honored in a few minutes. Congratulations to all of you and to this community for caring so much about healthcare and honoring the people that are dedicating their lives to taking care of all of us when we are most vulnerable. Thank you.